I mean, from the perspective of the healthcare provider and then on the patient on the other side, it's like, how do you build trust? Essentially, how do you build trust? And you build trust with accurate information, with compassion, with actually listening and being empathetic, and giving people an opportunity to see both the benefits and the risks on either course of action that's being presented to them, because there's always a consequence to both action and inaction, right? So are we actually talking to patients as if they're competent enough to be a part of the conversation, or just treating them like subjects that we need to stab and grab, right? So that's really important.
Welcome to Back to Doc. My name is Adele Onyango, and together with my co-host, we call him Ice Cream Kangaroo,
Yeah,
Ice Cream King. Now it's what?
I care.
I care, or just
But with
IK.
a K.
We are going to have such an exciting show for you because we're looking at...
Well, today we'll be looking at care providing. An interesting topic that I can't wait to dive into with our amazing guests.
Yes, and so we have Shola, who is a behavioral scientist, and we also have the very wonderful Chantal, who is a menstrual health specialist. But you can tell us a bit more about yourselves before we dive in.
I am a behavioral scientist who has a background in psychology. I've been working in the field of public health, but also living in Rwanda for the past year, and now I am just exploring the African continent.
Oh my goodness, that sounds interesting and fun.
Yes,
I'm
yes.
sure your passport has a lot of stamps.
It does.
And what about you, Chantal?
Well, I'm a menstrual health educator. I have a background in nursing and environmental engineering, but I'm really passionate about helping women and girls have healthier periods.
Interesting, very, very interesting. So we're looking at care provision, and I think we could bring it home to any moment that we've had to be the sole care provider for someone we knew. And I think when I was thinking about this topic, I wasn't the sole provider, but my late mom had breast cancer for years, so it would come on and off. And what I thought was normal in our home, which is like knowing when to give her what tablets and knowing what happens after dinner time, when you help her move from here to there. That was normal for me growing up. And it's only when you interact with other people, you're like, oh, wait, that didn't happen in your home. But when I think back, there was a bit of a drain as well that came with it, but that's the moment I'm taken to when I think about today's topic. Where does the topic take both of you?
For me, I think about, as my mom has been getting older, I have she's been encountering different health issues. And so trying to track her appointments and make sure she's taking the medication, make sure she's going to the next appointments, and then doing that from afar rather than being there in person with her in Chicago.
Oh, yeah. So that has a different anxiety that comes with it, right? When you're kind of doing it remotely.
One experience I had with personal care providing, not in a professional setting or a health setting, was I remember the first time my husband got really sick. We were living overseas. He had a high fever and he was delirious and saying crazy, wild things. And I just remember like, wow, he's in such a vulnerable state right now. And you want to get them through that experience, but you also want to keep their dignity intact, because this is still someone that you love and you respect, and you don't want to use their infant-like state when they're really sick as something that comes back or that you bring up again. And so how to care for him in a way that still made him feel dignified and loved and respected, even though he was in a really weak state.
But there's this thing that we hear out there that doctors are better doctors when they're treating others, but they can't really treat themselves. And does it apply to caretakers in your field? Do you find it hard taking care of yourself when you have anything, sickness, whatever it is?
No. I actually make sure I take care of myself. I feel it's important. If I'm not taking care of myself, and then who is? So I think it's important, and I try to motivate others to see it that way as well.
Okay. How about you?
Definitely with taking care of children, it can be so depleting and you're giving. But I think it's also important to know that a care provider has to be well to give good care. So I think I'm better at it now than when I was a new mom. When I was a new mom, I just thought giving was the name of the game. But now I know that I can't give in joy and love and in good presence unless I'm really being cared
You
for
gotta
as well.
take some for yourself.
Yeah,
Have you ever
definitely.
had experiences like if we take it to like a hospital or you go to a clinic and you interact with a healthcare provider, somebody who's meant to take care of you who clearly is having a bad day because your questions are not answered, your fears are not listened to. Have you guys had any of those experiences?
Yes. But I'll let you keep
Definitely,
talking.
not smiling, not introducing yourself. Like you said, not answering questions, being a little bit rough and coarse, and not really giving you a chance to say, okay, this is not okay, I'm ready, I'm not ready. It's kind of like, all right, come on, get on with it, and
Yeah.
let's get it over with.
Personally, I feel that there's some wicked nurses out there.
Mm.
Yeah, growing up, I just felt like there are
That's
some.
so weird.
So when I go to the hospital and I know I need to get that injection, because before the chloroquine tablets came out, you just knew it's chloroquine injection, and there was one other injection then, that was very painful. Forgotten the name, but that injection would take you back to your babyhood days.
Yeah.
And there's this particular nurse that she doesn't smile, and it's like she's come here, and but then there are those nurses that would take care of you and you don't feel anything.
Exactly. Or even explaining like the procedures. I know I've had an experience with a gyna. And first and foremost, like when you're going for some of those procedures, they're very like invasive. Some of the tools that we use are very cold and metallic. And this guy was not explaining anything. It was just like instructions, do this, do this. And even afterwards, when you're getting like your medication, because afterwards they tell you, okay, go to the pharmacy and get this. Nobody's explaining why is all this happening. And you kind of feel like you can't ask because the tone that's been set is already so harsh, But I wonder, what can we do to help also the care providers? Because I feel like there's no disconnect in how they're paid and the environment that they do this work, the things they see, because they're also humans. So sometimes you're constantly seeing either death or things that you can't prevent. Do those things matter in how they help us or change their behavior? Actually, yeah.
I think it definitely matters. I remember going for some procedure, probably a routine procedure, and they are cold towards me, and I ask them if they're okay, because I think that it's so rude to be providing a service and then they present to me as if they don't want to be there. And so I think it's important to set the tone up front that they are here to serve, because they're in a position of service.
I like what you say, because it's almost like you're now participating in creating the space that you want. Did they respond well?
I mean, I think it helps them shift.
Yeah.
Yes, it does help them shift and kind of make them aware of how they are coming off in that moment.
But what do you think should be the right action when you get poor service from a caretaker? Should you report them? What do you think should be the right action to take when it comes to it? Because I can tell that a lot of people watching this right now do face one situation or the other where they're not comfortable with the person that's attending to them.
I think it's fine. I'm very confrontational in the sense that I want to ask them questions and I want to know what's going on with them if they are kind of coming off rude. But if they aren't able to respond to me in a way that is pleasant or for me to understand them, I am fine with going to their supervisor.
And Chantal, what's your experience like in terms of the environment? Does it contribute to how the care provider treats the patient?
Definitely. I mean, I think back to when I was working as a nurse, just the caseload being so heavy. I remember in the textbooks being told how to communicate and care for patients, but the reality when you're actually in a stressed healthcare system is that you have way more patients than you should have. You're not getting cared for. You're not getting meals on time. You're just under a lot of weight. So I think it's really important that we see care providers as humans not just professionals, but at the same time, they need to be held accountable to how they're being supported. How are they being cared for as care providers is an important institutional conversation.
Kind of, I see it this way. I'm an actor, right? And sometimes I have a bad day and I have to go on set and I have to deliver a character. The audience wouldn't care how bad my day is going. What they want to see is performance. And I think that if you take on the job of being a caretaker, you should not allow external factors or whatever it is to affect your job. Because your caretaker primarily first is to take care of people, not just their health, but their emotions and everything, make them feel comfortable in that place where they came to.
That's so interesting that you say that, because it reminds me of something that happened in Kenya where the healthcare providers, so nurses and the medical officers, etc., were striking, and they were protesting because they weren't getting their pay from the government, etc. And very many Kenyans were saying, "Oh, that's wrong. You are in a job that's a calling. And when you leave the hospital, then what happens to us?" And so I've always gone back and forth with that, where I'm just like, I get the calling bit. And as a patient, I would love to be treated by someone who sees it as a calling, because I feel like you're more humanly like attached to it. But then also capitalism. So you have rent and you have school fees, etc. Like, where do you think it falls in that kind of like spectrum? A calling vis-a-vis a job that pays?
A friend who is in similar women's health space, and her grandmother used to say to her, "Why are you expecting compensation? It's a calling." I was a midwife, and she said, "But in your time, people sent you chickens and they sent you food and they shared in the harvest with you. You were compensated and held by the community in other ways, not just money." So if we're relying on money to meet all of our needs and be the only resource we rely on, then we have to take care of our healthcare workers.
Talking about money, something is heavy on my heart, and that's I sometimes you go to the hospitals and you see situations where a patient is brought in critical condition, and the doctors are asking for particular bills to be paid before they attend to the person. And so many people have lost their lives to that. Because sometimes you see people tweeting so much anger and disgust at a particular health institution that you watch this person die when you could have just attended to the person. Do you think, I know they have their personal experiences as hospitals, probably people they take care of do not pay the bills afterwards, but shouldn't life always come first?
Well, that's not the society that we live in. I feel that these hospitals, they're for profit at times. So they're going to be concerned about money. They're institutions, just like you were saying, we need to think about the system as a whole to see how we can make it more human-centered.
But do you think, honestly, it is different? Because as an actor, is there an oath that you take? I don't know if you just like to the camera,
about my career is very funny. Sometimes the movie you watch is filmed by 4 a.m. in the morning and they light it to look like daytime. So the person watching wouldn't know if it's day or night. They don't know if you've been up since 7 a.m. till 4 a.m. What they want to see is performance. And when you don't perform, you will see the tweets coming out. Yeah. What a terrible actor. He spoiled the movie. So you just have to perform.
Have you encountered like situations like that? And what's the chain of command? Like, so if you, as the receiver of this patient, want to help, is there like a boss figure here who's just like, nope? Yeah. There's a bottom line we have to think about.
I feel like in some countries, they're just really comfortable with the debt on the back end. Like we have the means to go after this person's resources on the back end. So and I know in the US, you can go into an emergency room. You're not expected to offer payment, but you do need to sign that you will pay it maybe at some point, like your consent. And then you just get billed on the back end. And some people deal with debt for decades as a result of that one unfortunate circumstance. But if you're in a country where you don't have a structure where you can grab those resources or hold that person accountable to paying their bills, I can see why there might be some profiling and caution, right? Maybe if you don't look like you can pay, we may never get paid. But at the same time, human life is worth more than any dollar amount.
Yeah. And I think about even my own experience in terms of like your interaction with healthcare providers and how it changes my behavior as a patient. if I go to a place and they're cold and no answering of questions, I'm just like, you know what? I'll figure this out myself. I may not have the degree, but I'll figure it out, you know? Because already, if we look at even, for example, reproductive issues around women's health, it's already so scary, you know? There's already so much stigma. So even asking a question around your period is scary in itself. And if somebody is standoffish, you might change your mind and say, I don't want any contact. Have you guys had that experience?
I mean, I even just recently, maybe sometime last year or so, I was dealing with some issues around reproductive health, fibroids, and the doctor was they were very cold. They were just suggesting, oh, maybe you should just consider getting a hysterectomy, which is a very sensitive topic and should not be thrown out as an option with such like just saying it as if it's nothing. And so I was less inclined to go back to the hospital and more looking at natural remedies.
Wow. Yeah. And if we bring it to like vaccines, there are people who, because of this energy or lack of warmth, just change their minds altogether about vaccination.
Yeah, I mean, if you go to a healthcare provider who is not compassionate, doesn't have time for your questions, and won't entertain any of your, concerns, then you're less likely to take their word as really being truthful, right? You're less likely to trust someone who can't even treat you with dignity. So maybe their recommendations for whatever course of action there's going to be some hesitance if you can't even treat me like a human being.
And so how do you handle that if somebody comes in for like specifically a vaccine and change their mind? How do you change their behavior, or have you encountered cases like that?
I mean, from the perspective of the healthcare provider and then on the patient on the other side, it's like, how do you build trust? Essentially, how do you build trust? And you build trust with accurate information, with compassion, with actually listening and being empathetic, and giving people an opportunity to see both the benefits and the risks on either course of action that's being presented to them, because there's always a consequence to both action and inaction, right? So are we actually talking to patients as if they're competent enough to be a part of the conversation, or just treating them like subjects that we need to stab and grab, right? So that's really important.
Yeah. So centered around your line of work is very interesting. Menstrual health is something that especially guys, a lot of us do not hear about. But we know that we have a lot of women out there that take contraceptives, a lot of people who take birth controls, a lot of people stop their periods, And I was having a conversation with Adele earlier, and I was like, are there after effects, of that come to people or women that constantly use this birth controls?
I mean, what we see is that many women are told it's no problem, just come off when you're ready to have a baby. But being on birth control for 10 years has no effect. But what we do now know is that there's a certain amount of depletion that happens in terms of your nutrients, right? There's a certain amount of masking of real hormonal issues that don't come to the surface. So I know a lot of women who won't even consider birth control at all because they've seen this kind of it being thrown at everybody for every problem all the time. And no one's talking about like what could happen in the long term.
So is there any time in a woman's life cycle where she is not supposed to take vaccines, maybe during her period or during pregnancy or during ovulation?
That's an excellent question. There's definitely concerns if she's possibly pregnant. There are going to be different considerations on if a vaccine is safe for her at that given time, because there is a reaction in the body that could affect the fetus, right? But in terms of where she's at in the menstrual cycle, I haven't heard of how her menstrual phase might impact. There are times where there is a slightly lower immune response, particularly after ovulation. We tend to protect the fetus by like turning down our immune response. You don't want to attack this foreign entity, i.e. the baby. So I guess theoretically, probably before ovulation would be a time where her immunity might be a bit stronger to counter whatever reaction she might face.
So I think what we're doing is just unpacking the relationship between healthcare providers and patients. And when we bring it to Africa, the lack of enough professionals in different countries? How does that affect the relationship, and what can we do differently? From your experience in Rwanda, your experience in the medical space, what do you guys think?
When I was in Rwanda, they had a lot of health workers in community-based clinics. And so these were decentralized from the hospital, and they were just more community level. And I think it worked. Everybody did not have to go to the city of Kigali in order to get treatment. They could just go to their local health center.
And I think that helps, because then it's like people who you trust, they're part of your community, right?
And I think a lot of people psychologically think, I must see a doctor because the doctor is an authority on all things health, but maybe we need to diversify that a bit and see the benefit of nurse practitioners and nurses, and probably even alternative care providers like herbalists and midwives, and just to kind of diversify who people can go to get professional help other than the doctor.
And even just going back to your question, when it comes to vaccines, we should start telling ourselves our own stories as Africans. So like right now, there are different countries that are looking at creating research facilities that can create our own vaccines. So we're not always reliant on the West, but we never amplify or tell those stories to ourselves, So it starts there to say, hey, the Eastern African bloc, this is what we're doing. We're going to be manufacturing our own vaccines. These are the people behind it. This is the team behind it. So there's also pride where my country has this specialist and they're working on ABCD. And then the worth grows, and you can even ask questions because the team that created it is close by. And so you can ask questions when you're being told, get this vaccine, it was created in Kenya. You're better placed to be like, okay, by who? What happens when it expires? What are the effects? Because it's kind of closer, but we don't amplify our own stories of might, like what we saw with COVID, to take it back there with South Africa. So then the story is hijacked.
Oh, well, I think we've learned a lot from today's episode, and we can go on and on and on and on, but it's really getting to that time of the show where we have to say our goodbyes.
Exactly. We're so thankful that we had some incredible guests today, Chantal and Shola. Thank you so much for being with us. And
I like to call her SOD.
Oh my! I thought we made it to the end of the show.
We're not going past it.
I thought we made it to the end of the show without it. Thank you so much for watching this episode of Back to Doc. We hope that you gained something from it. Maybe you connected with the experiences. Maybe it left you with questions, but now you have somewhere to start answering them. And we hope that you'll catch the rest of the episodes from myself and IK. Goodbye.